Reasons for congestive heart failure. Congestive heart failure, commonly known as CHF, develops when the heart becomes too weak or too stiff to pump blood effectively. Although the condition can affect people of various ages, it is most common in adults over 50, particularly those with underlying cardiovascular issues or long-term lifestyle risk factors. In the United States, CHF remains one of the leading causes of hospitalization among older adults, and it often develops gradually over many years. Several reasons contribute to the development of this condition, and understanding them is the first step toward prevention and better heart health. One of the primary reasons for CHF is coronary artery disease. A condition in which the arteries that supply blood to the heart become narrowed or blocked due to plaque buildup. When the heart muscle receives inadequate blood flow, it becomes weaker over time. Repeated episodes of reduced blood supply can damage heart tissue, making it harder for the heart to pump efficiently. Americans who have high cholesterol, high blood pressure, diabetes, or a long history of smoking are at significantly higher risk of developing CAD, and therefore, potentially, CHF. Another leading cause is hypertension, commonly known as high blood pressure. When blood pressure remains elevated for many years, it forces the heart to work harder to pump blood. Over time, this constant strain thickens or weakens the heart muscle. In many cases, the left ventricle, the main pumping chamber, becomes enlarged, eventually leading to heart failure. High blood pressure is extremely common in the U.S., affecting nearly half of the adult population, and it remains a silent but strong contributor to heart failure. Heart valve disease is also a major contributing factor. The heart has 4 valves that regulate blood flow, ensuring it moves in the correct direction. If any of these valves become narrowed, a condition called stenosis, or leaky known as regurgitation, the heart must work extra hard to compensate. In the long term, this additional workload can weaken the heart muscle. Valve problems can occur due to congenital defects, infections like rheumatic fever, or age-related wear and tear, something commonly seen in older American adults. Symptoms of congestive heart failure. Congestive heart failure presents with a wide range of symptoms, and these symptoms often develop slowly and worsen over time. Early signs are commonly mistaken for normal aging, fatigue, or respiratory issues. However, recognizing symptoms early can significantly improve treatment outcomes and quality of life. One of the most common symptoms is shortness of breath, medically known as dyspnea. This occurs because fluid builds up in the lungs when the heart struggles to pump blood effectively. People with CHF may experience breathlessness during physical activity, while lying flat, or able not rest. Waking up in the middle of the night, gasping for air, is a common sign of worsening heart failure. Fatigue is another major symptom. As the heart becomes weaker, less oxygen-rich blood circulates throughout the body. This makes even simple tasks like walking, climbing stairs, or carrying groceries feel. Many people describe the tiredness as overwhelming or persistent, even after a full night of rest. Swelling, also known as edema, commonly appears in the ankles, feet, legs, or abdomen. This happens because the kidneys receive less blood flow and start retaining fluid. As fluid builds up, the swelling becomes more noticeable. Shoes may feel tight, socks may leave deep marks, and in more advanced stages, the abdomen can become distended. Another noticeable symptom is rapid weight gain due to fluid buildup. Gaining 2 to 3 pounds overnight, or 5 pounds in a week, can indicate worsening heart failure. Doctors often advise patients with CHF to weigh themselves daily to monitor fluid retention. Chronic cough or wheezing is another symptom, often caused by the fluid accumulation in the lungs. The cough may produce white or pink, frothy mucus. This symptom may worsen when lying down and improve when sitting upright. People with CHF may also experience rapid or irregular heartbeat, known as arrhythmia. As the heart struggles to pump, it may beat faster to compensate. Some individuals feel palpitations, sudden fluttering, or pounding sensations in the chest. Decreased exercise tolerance is very common. Activities that were once easy may suddenly become difficult. People often notice that they cannot walk as far or move as quickly without becoming breathless or fatigued. Treatment of congestive heart failure. Treating congestive heart failure focuses on improving quality of life, slowing disease progression, reducing symptoms, and preventing hospitalization. One of the most important aspects of treatment is medication management. Doctors commonly prescribe a combination of drugs that work together to support heart function. ACE inhibitors and ARBs help relax blood vessels, lower blood pressure, and reduce strain on the heart. Beta blockers slow the heart rate and decrease the heart's workload, improving its ability to pump. Diuretics, also known as water pills, help reduce fluid buildup, easing swelling and shortness of breath. Aldosterone antagonists further reduce fluid retention and protect the heart muscle from long-term damage. Lifestyle changes play a massive role in managing CHF. Patients are often advised to follow a low-sodium diet because excess salt causes fluid retention, making heart failure symptoms worse. Fluid restrictions may also be recommended for patients with advanced stages. Maintaining a healthy weight, engaging in regular physical activity, and avoiding smoking or alcohol are essential steps. Exercise programs such as cardiac rehabilitation have been shown to significantly improve heart function, stamina, and mental well-being. Monitoring daily health is another crucial part of treatment. Patients are encouraged to weigh themselves every morning to detect rapid fluid buildup. Sudden weight changes can indicate worsening heart failure and allow doctors to adjust medications before symptoms become severe. For people with certain types of heart failure, device therapy may be recommended. Implantable cardioverter defibrillators, ICDs, prevent sudden cardiac death by correcting dangerous cardiac resynchronization therapy. CRT helps the ventricles pump more efficiently by coordinating their contractions, improving overall heart function.